Two incredible women have spoken. Let me welcome on stage another brilliant speaker this morning. It gives me great pleasure to call now on stage Anuradha Gupta, the President of Vaccine Innovation and Global Immunization at the Sabin Vaccine Institute. Welcome, Ms. Gupta.
So good morning, everyone. I realize that we've had two inspirational, bright, brilliant speakers who really set the tone for the day and for the official launch of the Global HPV Consortium. I really want to welcome you all to this historic occasion when we are coming together to start a global to local movement to accelerate the fight against HPV and cervical cancer. And why is now the time to act? Because incidence of cervical cancer continues to rise among young women aged 15 to 49 years. Barkha said, cervical cancer claims a woman every 2 minutes. Now, cervical cancer is claiming a woman's life every 90 seconds. And if we don't act today, by 2040, cervical cancer would kill a woman every 60 seconds. And it is a colossal tragedy because all these deaths can be prevented, as you heard from the earlier speakers. I must also emphasize that cervical cancer is first and foremost a disease of inequity. And here you can see that in low-income countries, the incidence of cervical cancer is 3 times higher compared to rich countries. But look at this data about mortality rates, and you can see the horrendous differential between poor countries and rich countries. Women dying of cervical cancer in poor countries, 8 times higher compared to rich countries. And that is our wake-up call, because that shows the yawning gap in terms of access to vaccination, screening, and treatment services in lower-income countries. There are also vulnerable populations that we have to keep in view. Women living with HIV have a 6 times higher risk of developing cervical cancer. So we have to make sure that these women are put on top of the HIV agenda, but that these women also get due attention in vaccination plans. And we are fortunate that to prevent HPV and cervical cancer, we have an increasing and expanding set of tools at our disposal. Most of the cancers are hard to prevent, but cervical cancer can be prevented. We have effective vaccines. We have diagnostic tests which are so easy to administer. And you really heard from Ms. Nuzul this morning about self-administered tests that can actually detect early onset of disease. And then we have easy-to-use treatment methods to actually get rid of precancerous lesions. However, it is unfortunate that the benefits of these tools are not being reaped optimally today. You see the HPV vaccination rates, only 1 in 7 eligible girls received HPV vaccination in 2022. And this is 14 years after the vaccine was introduced. And if you start to look at vaccination rates in lower middle income countries, they are much, much lower. And there's so many countries that haven't even introduced this vaccine so far. The data on access to screening services is quite thin, but we know for sure that in most low and middle income countries, the mortality rates are higher because screening facilities are highly inadequate. And on treatment of precancerous lesions, the data is even thinner. So really something for us to keep in mind as an action point moving forward. What would inaction entail? It would mean that the global economy would lose $28 billion by 2030 because of the loss of women in the workforce, and also not just because of productivity losses, but the broader economic, social, and health losses. And as was highlighted earlier, treatment in low and middle income countries can be highly expensive. It is prohibitive, which really means that women, when they get cervical cancer, the chances of their survival are very bleak because they cannot access these treatment facilities. And therefore, investing in prevention, as Helen said, is not just the right thing, but it is also the smart thing. So what can we do? As was said, this is the first time that the world got united in 2020 to eliminate a cancer, and we have a vision to pursue, and we have a wonderful opportunity to seize this moment and really accelerate the fight. From the consortium, we are laying down 4 guiding principles for ourselves. This is integration, equity, heterogeneity, and sustainability. Integration is key because we know that if vaccination, screening, and treatment do not come together, do not join hands, this whole idea or dream or aspiration of eliminating cervical cancer is not going to be realized. So really, the WHO cervical cancer elimination strategy is so clear that vaccination, screening, and treatment must be provided for in all countries. And then build a unique transdisciplinary alliance. It is recognizing the importance of integration that this consortium is evolving into a transdisciplinary alliance. You would see that represented in the attendance here, where we are unifying organizations, agendas, and change makers who have historically and traditionally worked very independently of each other. But this consortium is trying to topple and really tear down those silos and those walls, bringing cancer, HIV, non-communicable diseases, gender equity, adolescent health, reproductive health, and many others together. This list is illustrative and not exhaustive. You look at change makers, researchers, women and youth advocates, private sector industries, civil society organizations, implementation partners, policymakers, and we have representation from a range of these change makers here in the room today. I'm very glad to share that the consortium already has 22 members now that have signed up to this new, fresh approach that the consortium is taking. And you can see the diversity. It's not the number which is important. It is the diversity. It is the unique strengths and comparative advantage that these partners are bringing. And you can see they are global level partners, but they're also regional, country level, and community-based partners. And the interest in becoming a member of the consortium continues to grow. The second guiding principle for us is focus on equity, undiluted focus on equity, really focusing on those countries which have disproportionate burden of disease and deaths. Within countries, those high-risk populations, like women living with HIV, marginalized populations who are unable to access services easily, also those groups who have to constantly face negative gender norms and stereotypes. For example, transgender individuals who are not even a part of the SAGE technical guidance, which is all about boys and girls, but disregarding the identity of transgender individuals. The third principle is to embrace heterogeneity. We know countries and communities are not alike. They are very unique, very different, very distinct. So really investing in local solutions is going to be an important focus of this consortium. And finally, it is sustainability. What we are seeking to achieve is sustainability of action, sustainability of investments. So really building political will, making sure sufficient and smart domestic financing is made available for this whole holistic cervical cancer elimination strategy, but also supporting countries in introducing cost-effective, community-owned, integrated integrated service delivery models, which do not exist in most countries today, though they are highly resource constrained and would actually gain a lot by integrating delivery of services. So a lot, and then adaptive leadership at all levels, unlocking that is going to be so important if we want to achieve a success. So what is the request here of all those people who are in the room? Engage in the discussions. I really want to thank all our incredible partners for staying so engaged with us during the past couple of months. That's why we are where we are today. But continue to engage in these discussions today and tomorrow, and then beyond that, because the aim is to build an action plan before the end of the year, an action plan that helps us deliver on what we are committing to today. So there is a promise that we are making, but that promise must be delivered. Thank you very much for your attention. And I'm going to request Nurul now and Helen to come onto the stage so that we can ceremoniously launch the consortium in line with the Malaysian tradition.
As they're coming on, I was just staggered by the statistics that you showed on screen. What is at the heart of this inequity? Because you're right, this conversation is not about a vaccine alone. You cannot dislocate the conversation about the vaccine from the conversation about equity and equality. What is at the heart? If you had to use one word that is at the heart of this inequity, what is that word?
It is chronic neglect. Barkha said it is chronic and consistent neglect of marginalized communities. And that has led to compounded vulnerability and multiple deprivations. So when you go into these communities, you just find one after another problem. And that just piles on. So it is really these communities that are bearing the brunt of not just one health challenge or one economic challenge, but a whole range.